In Larimer County, Colorado, an innovative solution is making waves in the field of student mental health and crisis management. Launched in November 2022, the YCRT is a collaborative effort between the Larimer County Sheriff's Office, Thompson School District, and Summit Stone Health Partners. This unique team pairs a school resource officer and a mental health crisis clinician to tackle crises in schools head-on.
There was an overwhelming need for more mental health support in the school district, particularly after the COVID pandemic that caused students to become isolated and systems to kind of break down in a way that we hadn't seen before.
What we found when school opened back up was a lot more severe cases of kids just kind of breaking down, having more crises while they were at school. And our co-responder unit was able to respond to and assist some of those kids.
With the success of co-response across the nation, the idea was to try to incorporate that in a school setting in order to allow SROs to stay and remain in building, as well as provide some expertise on the mental health side.
As being a school resource officer, we learn a lot of the community inside of the school district. It's very different from typical law enforcement work. When you are working with students that are struggling, it does take a lot of patience at times to be able to work with students. And it takes a lot of collaboration, so it takes a special person.
We started discussing the possibility of having a co-responder team that was specifically based in the school system that could respond to those crisis incidents and help de-escalate the situation for both the student and the school, but then also take that crisis out of the school, work with the counselors, work with the school administration to get the school kind of back to normal, and then allow that team to continue to work with that child and their parents and family in order to come up with a safety plan and or to get that person the help that they needed through like a mental health treatment center.
I think collaboration is something that is so imperative when we start talking about students. It takes so many different people to effectively support a child in an educational environment. And this was just bringing in another piece, another resource to help support students, not only in crisis, but just in general, to help them, to give them somebody safe in the building.
As a whole, a lot of our job is building those relationships outside of crisis, so that way when a crisis does occur, we understand how the school operates, and the school understands how we operate. So we try to go into the schools and be there on a good day so that, one, the students know us and we're not only there when something is happening in the school, but we're also there as a part of the community and they start to see us as a resource. Staff in every school are protective. Their kids are their kids. And so they don't want just anybody to come in and have those conversations that are deeply personal and scary. So having those relationships outside and that foundation to build off of allows for any student to enter into the equation and still get the best service possible.
A huge part of our job is building those relationships at the school administrative level and then taking it down into each school specifically, having those conversations and talking about what are we seeing that are a problem in the school district and then how can we respond to that. Kind of seeing the different trends going around the nation, figuring out in our community what those trends look like and be able to tailor that specific to be able to serve each school and each student.
What happens is that we move from a pure response model into a prevention model, which is really what we want, is to prevent the crisis, to prevent the next big thing from happening in our schools.
Through this partnership, we identified that need of not only having the support of the law enforcement SROs, but also providing support to the school system in the environment of the school setting. So being able to dispatch a behavioral health clinician with specialty crisis expertise in the school setting with a school resource officer is something that we certainly saw a need across the community, and in partnership with Thompson School District, we're able to intervene and see that expansion through this past year.
I think it's just a matter of having a level of support that maybe wasn't around before. We're at over 500 calls for service within an 18-month period. Just last year we had approximately 344 calls for service. So I think it shows the innovation of once these school-based professionals found out about this resource, you can just tell by the numbers of how much it was needed and how much it's leaned upon. So I would say that that collaboration has brought up new ideas has brought up new processes and has really implemented a level of support in Thompson that's really not found anywhere else.
The innovation comes from the partnerships and the investment in the partnerships to make this program work and be able to offer a service that's coordinated, that information is shared in a really collaborative way that is at the best interest of the individual and the family that is being served.
I think a lot of credit goes to our team, and I think without their dedication, their commitment, and their passion to really help these kids, I think the program wouldn't be successful at all. So I think they are owed a great debt of gratitude for the tremendous positive impact that they've had on the kids that they've been able to help. In Larimer County, the commitment to student well-being is clear. The Youth Crisis Response Team exemplifies what can be achieved through partnership, innovation, and dedication. For more information on the YCRT and its impact, please visit our website.